Welcome to another episode of the Keep Them Guessing podcast. On this episode, we definitely need to keep people guessing on whether you've had eyelid surgery or not. Some of the worst eyelid surgeries can make people look very weird and alien-like. So blepharoplasty is a fancy word for it. Let's get into it, both upper and lower blepharoplasty. The eyelids. The eyes, Persians, ancient cultures, everybody calls them the windows to the soul. Many cultures, all you see is the eyes, very expressive. How you are, whether you're sad, angry, frustrated. It goes into the little expressions of your eyes, your eyebrows. When we say in my culture, halat chesh, that means like basically kind of how the eyes express themselves. When you do an upper or lower eyelid surgery, you need to make sure that you do not change the characteristic of that person in general, because you will change the way their soul is being perceived. So actually, eyelid surgery is very, very in-depth, deep, profound surgical alteration. In aesthetics, it's one of my favorite areas, and I think it's the holy grail in performing the proper facial rejuvenation when you combine it with a facelift and a brow lift. We've talked before at depth, and maybe we'll reintroduce it again on this podcast with brow lifts, but I'll just get into it briefly. We'll cover that and then get into upper and then the more complicated lower blepharoplasty or eyelid lift. With a brow lift, if you look here, approaching it in the most common way that I like to do it in my practice is endoscopically, which means I'm grabbing a scope, a camera, you're doing it all through a camera. Now you can lift the mid-face, and some people even do most of their facelifts with an endoscopic brow lift approach or from above with the camera. But when you go in through these little incisions, when you go and dissect, what you have to do, and every surgeon should do this, you have to release the ligaments that bound the brows down. Everything in our body is held to the bone with fascia, ligaments, and different anatomy that otherwise would just melt off the bone. Your brows are stuck here for a reason. When they start to descend or get ptotic, P-T-O-T-I-C, they start to fall down. The hooding you get laterally, the crescent formation here, the bags you get under your eye, and then you get your puffiness, or some people get hollowing out and look older in their upper eyelid. The first thing you need to look at is to see if the brows are in the right position. If the brows are super low and you do an upper eyelid surgery, you're not going to get the full breadth of rejuvenation of what we call the periorbital or orbital anatomy region. The eyelids and the brows go together, just like the lower lids and the cheek area go together there. So let's talk about brow lifting. When we do that endoscopic approach, you got to go and remove the corrugator muscle, or at least weaken it. Look how large it is. This was actually from a study I did on numerous cadavers in the middle of the night, dissecting it out in Dallas. It actually won an award, the Gaspar Anastasi Award, at the ASAPS meeting in Orlando back in the day. It was such an important study because this is what Botox, Allergan, and all these companies use to really know where the corrugator muscle even lives. This is the muscle that causes the 11 lines or 111 lines. When you weaken it or remove a portion or all of it in some situations, carefully with the camera, you can see here the nerves are in the way. You got to know what you're doing. Those nerves have to be out. A lot of surgeons do not go extensive enough to this corrugator muscle through this approach to remove it. When you remove a portion or all that muscle, you may never need Botox again in your life, because you're not going to have these 111s, in some people 1,111s, and you're also going to be able to address the anatomy that goes across here. So when you go do this approach, you'll all of a sudden get this lifting naturally. You don't have to even go lift the brow. It just naturally kind of assumes a higher position. The next step is to release the muscle here. You can do it in a crisscross tic-tac-toe function where you go underneath and release the galea and different portions of underneath muscle, and you get these forehead lines that go across to dissipate and soften and go away. Sometimes if they're super deep and really, really thick skin, like if you look at mine, they're medium depth. We go and fill this with fat grafting to really seal the deal. So you're getting a smoothing effect and a natural lift just from the release. And some people believe, and some studies and research studies have actually shown, you don't even need to fixate the brows up. You don't need to put holes in the bone to fix it up. You don't need to do sutures. You don't need to use all these different devices to lift the brow. Just releasing the ligaments thoroughly and removing this muscle does enough. I like to go the extra step and grab a little bit of the cheek almost always, unless I'm doing a facelift at the same time. The high smash approach I use, I won't need to grab it from above with my camera approach. But I do want to address the brows, and I like to shape the brows and tail them up. Sometimes a lot of what we're doing is shaping. It's not necessarily brow lifting, it's brow shaping, brow contouring. Some people are very specific with the look they like. I always, when I do facial rejuvenation, especially eyelid brow surgery, I want to see pictures of my patients when they were younger. When you look at patients when they were younger, sometimes you'll see the brow really didn't even move much. So I can go and counsel that patient that we don't need to really put your brow way up there. We just need to do the release that we talked about. So endoscopic brow lift approach, corrugator muscle, ligamentous anatomy. Let's talk about the upper eyelid. The upper eyelid surgery we do, the zipper approach. If you look here, look at that zipper closing. It's one of the most elegant, beautiful things. I love seeing that close. It literally gives me closure and makes me feel like this. So that upper eyelid surgery is removing a little bit of redundant skin, especially women when they go and try to put eyeliner, eyeshadow on. That skin is hanging on their eyelash. You can see in this person, she had redundant fold of skin that's hanging on her eyelash. And afterwards, you can see she has a little bit of makeup up, did her lashes, and that whole eye just opened up. But it's still her. The soul is the same. The eye expression is the same. It just looks brighter, pops, glows, and it doesn't look overdone. Upper eyelid surgery actually can be done wide awake. I did it in my own anesthesiologist a long time ago. Done it for many people I know, just kind of in a 1 hour, 45-minute procedure by itself, upper eyelid surgery. Actually, as a side note, one of my favorite combinations to do that I recently did on someone, you can look at right here. My esthetician had upper eyelid blepharoplasty, fat transfer, buccal fat pad removal, fat transfer jawline, and a platysmoplasty. This is like a Regenolift 1, which we'll talk about later. That surgery did wonders to open up her eyes and make that personality shine and glow through. So upper eyelid surgery, sometimes you remove a little bit of the fat pockets and the fat pads there, but in general, I like not to. I do sometimes like to remove what's called the roof, ROOF, retroorbiculus oculi fat. That's a little fat pocket. It looks a little more yellow. If you can see right here, we'll show it to you. That yellow fat gets teased out. You never want to remove too much. That gives you a nice crisp upper eyelid crease without hollowing out your eye socket and making it look older and deeper. If you go deeper than that or remove the actual fat pads too much or remove them when they're not needed to be done, you can actually make someone look older. You do not want your upper eyelid surgery to make you older. That's the opposite of the effect we want here. So brow lifts endoscopically most of the time, knowing the anatomy. Upper eyelids combined together are like organic almond butter and organic jam without added sugar. It's perfect combination, especially gluten-free bread. You just heard about what I usually have for breakfast. So lower eyelid surgery, there was a very well-known surgeon back in the day named Bob Flowers from Hawaii who actually talked about how you should routinely do what's called a canthopexy, which is this ligament needs to be tightened whenever you do lower eyelid surgery, and I wholeheartedly agree. 100% of the time, I like to do that. Now, the lower eyelids are much more complicated than upper eyelids, so I personally don't like to do those awake. You could do them with deep sedation. We obviously inject all these areas with numbing medicine that has adrenaline in it to cut down any blood loss or bleeding and make the field super clean. You can see in this patient, I did his lower eyelid bleph. Huge bags his whole life. This is not an aging thing. You can have these when you're 22 years old. This is an anatomical variant that can make someone look older. So I blended his lid cheek junction by removing a little bit of the fat pockets that live in the lower eyelid. There's about 3 different areas divided by some muscle. You have your trough here underneath, which his was deep, so he had these big eyelid bags. Removing fat around the eye, as you can see, there's a theme here, is not really what you want to do. So one of the things I wrote up with a colleague of mine and my previous mentor and a good friend of mine, Dr. Rod Rorick, is the 5-step blepharoplasty, where you take all these different steps: pinch of skin removed, fat transposition or release of the ligament, fat transfer here, and a canthopexy. These combination of procedures rejuvenate and blend your eyelids so you don't see bags and you don't see this deep trough because you're filling it with fat, or you're transposing the fat across that ligament and into the cheek, and then you're lifting the cheek at the same time to meet that lower eyelid by doing fat transfer. To me, that is the most powerful way to do most lower eyelid or lower blepharoplasties. Some people only need a little bit of radio frequency. There's some people I go in with the InMode Accutite device. They're in their 20s, their skin, it's tight, their septum of their lower eyelid's tight. So I go underneath and just tighten that anatomy and the skin, and I do a fat transfer to blend that area. And in some people, they need a little pinch of skin removed. You want to be very careful how much you remove. You can see in this patient here, she had a lot of work done, but she really came together harmoniously because I did endoscopic brow lift, upper blepharoplasty, 5-step technique, including a pinch removal of skin. And we did a chemical peel on her as well as a high smash facelift. And look how nicely her lower eyelid cheek junction blends now, and the cheek got lifted and it met the contour of the new lower eyelid. That technique in someone her age was necessary to do all the different 5 steps along with the facelift. So in a nutshell, the eyes, upper and lower eyelids are truly an expressive, such an important part of who you are, your identity, your personality, your characteristic. They cannot be messed with. We all know of different celebrities who've had overdone eyelids, overlifted brows, beyond what they used to look like when they were younger, and start to look almost not human. And that kind of artificial appearance is what you want to stay away from. And one of the reasons this entire podcast is called Keep Them Guessing is for that reason. And in the eyelids, it's one of the best examples. It's the first thing people look at when they're talking to you. Has to be natural. So here's a few more examples of some before afters while I close. Just know you have options, and your surgeon should know how to do all those options together in a very synergistic, harmonious, balanced way. All of what we do in plastic surgery is like a symphony where every instrument comes together and creates that beautiful Beethoven Symphony number 5, 7, or in my case, one of my favorites, Vivaldi's Four Seasons. The upper eyelid, brow lift release together, synergistic, lower eyelid with cheek fat transfer or lift, facelift, transposition of fat, maybe skin tightening or a pinch sliver of skin removed. Together, what you get is periorbital upper third facial rejuvenation. And some people just need that and no facelift. So there's a lot of different ways to do this. Just remember, your surgeon needs to be certified by the American Board of Plastic Surgery or facial plastic surgery, or if they're doing just eyelid surgery, nothing else, the appropriate oculoplastic boards and academies. So thank you once again to the Keep Them Guessing podcast.